Good morning. Happy Wednesday. This is Nurse Eunice with Florida Training Academy, and we're doing our third medical terminology quiz. So I'm going to give you a few moments to get those alerts, and we will get started shortly. If this is your first time joining, my name is Nurse Eunice. I love coming on here to help you pass your exams, whether it's CNA, your nursing exams, CPR exams. I am your girl. So please, in the chat, go ahead and put your city wherever you are from, and if you can, if you are from a different city, maybe let me know where you are viewing from. And also, where are you in your journey? Are you a CNA student? Are you a nursing student, a medical assistant student? I would love to learn more about you. And we're going to get started in 5 seconds. So, good morning, Chrissy, Sham, Karen. Good morning, you all. And here we go. All right. So, what does the prefix Brady mean? Is it fast, slow, hard, or soft? Talisha says B. Karen and Chrissy also says B. So that's right. When you think of Brady, think of a turtle, and a turtle moves slow. So Brady is the prefix that means slow. It's commonly used in terms such as bradycardia, which means a slow heart rate. Number two, the term hepatomegaly refers to inflammation of the liver, enlargement of the liver, tumor of the liver, or removal of the liver. Hi, Sham from the UAE. All right, most of you all have gotten two correct. Good morning. So, hepatomegaly refers to B, enlargement of the liver. Hepato refers to the liver, and megaly means enlargement. So, hepatomegaly, when you put the prefix and the suffix together, means the enlargement of the liver. Three, which of the following terms means surgical removal of the gallbladder? Is it cholecystitis, cholelithiasis, cholecystectomy, or cholecystogram? Talisha, we are definitely going to have you in our prayers. Good luck on your exam today. You can do it. Anna says C. Talisha says C. Chrissy says C. Valentine says C and Rose says C. So the answer must be, hey, you are correct. It is cholecystectomy. It is C. So cholecystectomy is derived from the word cholecys, which refers to the gallbladder, and ectomy, which refers to the surgical removal of an organ or tissue. The suffix "ria" means flow or drainage, rupture, pain, or formation. I see a lot of A's, and you are correct. Think of diarrhea. So if you chose A, you are correct. So the suffix "ria" refers to flow or discharge and is seen in terms like diarrhea, which is excessive flow of feces. Number five, nephrolithiasis is the medical term for, is it inflammation of the kidney, kidney stones, removal of the kidney, or kidney infection? Revealing the answer in three, two, and I see some of you all learned a new term today. If you chose B, kidney stones, you are correct. So, nephro, of course, refers to the kidney, and lithiasis means storm formation. So, when you see nephrolithiasis, that's the medical term for kidney stones. What does the term myalgia mean? Is it muscle pain, muscle weakness, muscle enlargement, or muscle inflammation? I see a C, I see A's, I see C's, and we will reveal the answer in three, two, and one. If you chose a muscle pain, you are correct. You know that my refers to muscle and algia refers to pain. So myalgia refers to muscle pain. Number seven, which of the following terms means difficulty breathing? Is it tachypnea? Is it apnea? Is it dyspnea? Or is it eupnea? Yeah, for this one, I had to go ahead and pronunciate the words because it's early in the morning and it's hard for me to pronunciate everything without my morning cup of joe. So, which do you think the correct response is? I see C's, I see B's. Let's see if we get two more responses and then we'll reveal the correct. Hannah, that's not fair. You can't put D and C. All right, so here we go, everybody. Dyspnea refers to difficulty breathing. So the DYS, anytime you see that prefix in front of a word, that's talking about difficulty or pain, such as dysuria, painful urination. But in this case, the dia refers to breathing. So dyspnea refers to difficulty breathing. Remember, if your person is dyspneic, your patient, you can sit them up, make sure you call for the nurse. And while you're waiting for the nurse to get there, go ahead and get those vital signs, including their oxygen saturation reading. So you'll put the little probe on their finger. The prefix hypo indicates above normal, below normal, within normal range, or outside. Hypo. Yes, 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 yes. Couldn't trick any of you. If you chose B, you know that hypo means low. So this is how I like to think of it. If hyper is high, more than, when I was in college, I was hypo. I was so I couldn't afford the other OR. So whenever you think of hypo, think of Miss Eunice's pockets when she was in college. So hypo means below or under, and it's often used in terms like hypoglycemia or low blood sugar. Number nine, which term describes the surgical creation of an opening in the colon? Is it colostomy, colonoscopy, colectomy, or colitis? Let us see, let us see, let us see. And I am absolutely proud of you, Karen, Mary, Valentine, Merlin, Kershaw, Alberta. Yes, you all have it. So it is colostomy. As you were aware, colon refers to the colon, but the stomae refers to an opening. So the part of the organ that's protruding outside of the skin is referred to as a stoma. So when you think of colostomy, They're going to have a stoma. It refers to a created opening in the colon. So we're pulling the colon out so that the fecal matter can escape the body. Maybe the person was born without a rectum. Some children do have birth defects. Or if a person has stomach cancer, they would also divert the colon and the person would have a stoma, thus a colostomy. 10. What does hemiplegia mean? Is it paralysis of both legs, paralysis of one side of the body, paralysis of the lower half of the body, weakness of one side of the body? Hemiplegia. I see B's, I see C's, I see an A. All right, so for this one, we're all around the board. So we're going to teach you a new word, hemiplegia. When you think of hemi, think of half. So hemi means half and plegia means paralysis. So hemiplegia is the paralysis of one side of the body, such as if a person has had a stroke. So sometimes your stroke victims will have, they can't move one side at all. And so we will say that they have hemiplegia. Number 11, the term hyperglycemia refers to low blood sugar, high blood sugar, normal blood sugar, or no blood sugar. Yes, this one was easy. I expected everyone to get this one correct. Easy, easy, easy. So if you chose B as in boy, you know that hyper means above or excessive, and glycemia refers to glucose in the blood. When a person has a chronic state of hyperglycemia, they're usually diagnosed with diabetes, and that's when they would be either prescribed oral anti diabetic agents or prescribed insulin. Number 12. This is easy. What does tachycardia mean? Slow heart rate, fast heart rate, irregular heart rate, or normal heart rate? Yes, Krishan. Yes, Alan Queen. Blessing, Dashia. So many names. I kind of miss one, Kersha. So you are absolutely correct. Tachycardia refers to or means a fast heart rate. So tachycardia can occur due to fever, pain, anxiety. Tachycardia for an adult is when the heart rate is higher than 100. But your nurses usually don't get too concerned until it's approaching about 140, 150. Because if it's pain, your nurse would be able to maybe give a pain pill or reposition the person, and hopefully that would decrease their pain and thus decrease their heart rate. The suffix itis indicates enlargement, tumor, inflammation, or surgical removal. You know, I'm doing my nurse dance. Mary, Flossie, Anna, Hannah, Crystal, Valentine, Alan, Queen, Marilyn. Yes. Itis refers to inflammation and is commonly seen in terms like arthritis, inflammation of the joints. Next, which of the following terms refers to the visual examination of the bladder? Is it cystoscopy, cystitis, cystectomy, or cystogram? I see B's, I see C's, I see an A. I see a D. So for this one, we're going to learn this one together. The visual examination of the bladder is called a cystoscopy. Yes, they take a little small scope and they go through your urethra, your pee hole. Yes, a little camera, and they can visualize inside of the bladder. So cysto refers to bladder, and scopy means visual examination. And usually they can do that with a scope that has a camera attached on the end. All right, and so if this is your first time here, we have downloadable products on our website, fltraining.com. We also have printable medical terminology cards. If you can come back tonight at 6 p.m., I will go through every medical term that I have on those flashcards. So plan to be there for about an hour. And if you're unable to watch the live stream tonight at 6 p.m., you can always just catch it later whenever you watch the rebroadcast. Number 15, osteoporosis is a condition characterized by A, inflammation of the bones, B, increased bone density, C, decreased bone density, or D, bone tumors. Osteoporosis. I see C's, I see A's, it's about half and half. Chico says C, Chrissy says C, and Flory says C. A lot of you said C, and a lot of you were correct. So osteo refers to the bone, and porosis refers to porous or thinning. So osteoporosis is a decreased bone density. Some of your older patients, particularly women, whenever they start having those hormonal changes, you'll see the doctor start prescribing them supplemental calcium, and that's to help treat conditions such as osteoporosis. Number 16, what does hypokalemia mean? Is it low blood sodium, high blood potassium, low blood potassium, or high blood sodium? Guy, Ama, Chrissy, Shalom, yes. And Florence and Rose, I see your answers too, and Flory. So, hypokalemia refers to low blood potassium. So, hypo, of course, means low. Cal refers to potassium, and emia means in the blood. So, hypokalemia means low blood potassium. Oh, let's go back. So, if a person has low potassium, they need to be eating foods that are rich in potassium. Yes, in the hospital, we can give them an IV bag that has we call it a banana bag that has nutrients in it, or we can give them a bag of potassium. But if you're studying to be a CNA or a nurse, you have to know what foods are high in potassium. Can anyone in the chats list two foods that are high in potassium that you can give somebody who has a diagnosis of hypokalemia? I'll give you about 30 seconds. I need foods that are high in potassium. I see bananas and cantaloupes. Yes, great job, team. Plantains, yes. All right, so number 17, the term bronchoscopy refers to the surgical removal of a lung, visual examination of the bronchi, inflammation of the bronchi, or collapse of the bronchi. Bronchoscopy. No one should get this wrong. No one should get this wrong. Yes, so many B's, because we know that if it's a scopy, they're going to take a scope and they're going to go down and they're going to look. So the way that we visualize inside of someone's body is to take a scope and look. So broncho refers to the bronchi, the very base of the lungs, the little branches. And scopy refers to visual examination. So when someone has a bronchoscopy, the doctor takes a tube with the camera on the end. Of course, the person's going to be sedated. They take that scope, that tube, and they take it from the airway, from the mouth down into the lungs, and that way we can see what's down there. Is it a blood clot? Is it a tumor? And that's also how they can do a biopsy, how they can get some tissue to know if a person has lung cancer. So bronchoscopy. What does hematuria mean? Is it blood in the urine, blood in the stool, blood in the lungs, or blood in the vomit? You're welcome. Yes, everybody, you know that hematuria means blood in the urine. So hema is blood, urea is urine. So hematuria refers to blood in the urine. Why would a person have blood in the urine? They must have a UTI, something irritating their urinary tract, or it's that catheter. When they have that catheter and it's tugging, which is why we want to have you secure it to the upper part of their thigh, because if that catheter is tugging and just moving around, that would cause irritation, which would lead to microscopic bleeding or sometimes gross, a large quantity of blood. And so you as the CNA, you're supposed to be looking at all of their bodily fluids when they come out, and that will help us determine the best medical plan of care for that patient. So if you start noticing blood in the urine, please let your nurse know right away. Number 19, which of the following terms refers to inflammation of the meninges? Is it meningitis, encephalitis, myelitis, or neuritis? I like saying that word, meninges. Can't trick you at all. Everybody has the correct response. It is meningitis. Great job. 20. The term dysphagia refers to, is it A, difficulty speaking, B, difficulty swallowing, C, difficulty breathing, or D, difficulty urinating? I see A's, I see B's, I see a lot of B's. So we're going to go with B. Let us see. If you chose B, difficulty swallowing, you are correct. So dys, we talked about before, refers to difficulty or pain, and phagia refers to eating or swallowing. So dysphagia means difficulty swallowing, which can happen after a person has had a diagnosis of a stroke. So you want to make sure they're eating the appropriate foods for their abilities, not their disabilities. For example, maybe they can't eat a hamburger, but they can eat a mechanical soft meal or something that is pureed. And you want to limit distractions and, of course, have this person in a high Fowler's position. 12. Which of the following is the medical term for the removal of the spleen? It is splenomegaly, splenitis, splenectomy, or spleen, or whatever that word is. You all pronounce it for me. You're younger than I am. No, Marcia, we can't help you get certified in Jamaica because you're in a different country. But what we do, what we teach here on our channel suffices for the entire world because we're teaching medical concepts that are based off of national standards in the United States. And as you know, most of the research that's used globally is from the US. So while I cannot get you certified in Jamaica, I can help you pass your test once you attend a school in Jamaica. So, everybody, I see B's and I see C's. The correct response is C. Spleen refers to the spleen, and ectomy is the surgical removal. So, splenectomy is the removal of the spleen. 22, the term cyanosis refers to yellowing of the skin, bluish discoloration of the skin, redness of the skin, or green discoloration of the skin. Everyone should get this right. And I feel like I know so many of you all, like Delip, we got Chrissy, um, Karen, Robin, Bless. So you all are just so amazing. And thank you all for tuning in. And we'll reveal the answer in three, two, and it is B, cyanosis, bluest discoloration of the skin. So cyan refers to blue and osis indicates a condition. So cyanosis refers to a bluish discoloration of the skin, and that happens most commonly whenever the person has hypoxia or low blood oxygen. So when the organs are starting to die from the lack of oxygen, they start to change colors. The face could be a bluish color, the lips could be blue, the fingertips could also have a bluish color also. 23, which term means inflammation of the joints? And I'm not even going to read these out because you all should know this one. That is right. So, if you chose B, arthritis, you know that arth refers to joints and itis means inflammation. So, arthritis is the inflammation of the joints. And how a CNA, nursing assistant, would help someone with arthritis is to keep them moving, have them do the range of motion, exercise their fingers, do some massage, put warm lotion on their hands. You warm the lotion by rubbing it in your hand, and then you can apply it to your patient's hands or whatever their joint is that is painful. And then of course the nurse is going to give some pain medication. If we allow these persons to move, their stiffness, their joint pain will decrease. So if you have a person who's always complaining about pain, more than likely they are not moving that affected joint, which is making the stiffness and the pain worse. So patients with arthritis need to move. 24, what does the term tachypnea mean? Is it slow breathing, normal breathing, fast breathing, or difficult breathing? I see C's, I see B's, I see way more C's than I see B's. I even see an A. Chico Boy says tacky means fast. So, without a doubt, Chico, C, fast breathing. So, tacky means fast, and Nia refers to breathing. So, tachypnea refers to fast breathing. 25, the term neuralgia refers to, is it A, inflammation of the nerves, B, tumor of the nerves, C, pain along a nerve, or D, weakness of a nerve? Atta says C. So, yes, for all of you all who chose C, you remember that "neur" refers to nerve and "algia" refers to pain. So, neuralgia is pain along a nerve. So, when someone complains of, oh, my sciatic nerve hurts, that would be an indication that that person has neuralgia. So, everybody, we have reached the end of this morning's video. When I tell you it's a holiday, so I'm coming on here twice. So the holiday is Juneteenth, whether you celebrate it or not, it's a day off for me. So I am going to come back on here tonight at 6 p.m. and I will review over 150 medical abbreviations with you all. So if you haven't done so, please like the video. It helps us in the algorithm. It helps push our content out to new viewers. And if you can also come back tonight at 6, we'll learn more medical terms together. So you all, this is Nurse Eunice. I appreciate you all so much. And thank you also. And I will see you tonight at 6 p.m. Have a blessed day, everybody. Bye.